Hello, I'm Faith Brown. I'm the clinical specialist for Sunrise Medical UK and Ireland, and I'm here today to show you how to look after your J3 backrest. A question might come up, really, why do you need to maintain it? To be fair, these backs are designed for quite heavy use and even a little bit of abuse. But if you want to get the best out of it, it needs a little maintenance time to time. And by the best, I mean that you'll continue to have support for your lower back to relieve strain, prevent pain, helps relieve pressure under your bottom, and almost more than anything, it makes it a little bit easier to propel the chair if it's operating in a nice, secure way. So without further ado, let's get to it. Number one bit of maintenance that these backs requires no tools at all, and that is to wash the upholstery. The upholstery is attached with Velcro. It makes the upholstery attach quite securely, but it also makes it fairly easy to take off. They can be washed at up to 60 degrees centigrade. We recommend that you just leave it out overnight to dry. Please don't put it in the tumble dryer, it's not good for the fabric. But in most cases, if you leave it out overnight, it will be dry by the morning anyway. Other top tip, make sure before you put it in, you close it back up, and that's only because with Velcro, any hook Velcro, it's a little bit rough and scratchy, and it might scratch other things in the wash, or it's even possible it might scratch the front of the upholstery and cause it to pill. So best to just close it up before you put it into the wash. This is also an ideal time to look and see, is there any stitching that's working loose? Are there any tears? Is it pilling? This upholstery is quite tough, and many people do use it for years, for the entire life of the backrest. But by having a little look, and if you're somebody who maybe will need a replacement, you can get a replacement before it's an absolute emergency. Last thing I want to say though about washing it is also it keeps the foam nice and fluffy, so it's just that bit more comfortable. Next bit for tools, the only tools you'll ever need for a J3 back are two 10mm spanner and a 4mm Allen key. Probably the biggest bit that can sometimes work a little bit loose, particularly with heavier users, are these two bolts here. And that's because these two bolts are the interface between the backrest and the wheelchair itself. All you do, take your Allen key, pop it in the bolt, make sure it's in, give it a good tighten until you have resistance, and that's plenty secure. Some people may have a slightly different type of hardware, the compact type. It looks a little bit different, but you'll notice still same thing. Two bolts that take a 4mm Allen key, tighten them up, and you're absolutely fine. Next bit, take the backrest off, and you'll find analogous two more bolts on the inside. Same thing, pop the Allen key in, give it a little tighten, and that will be secure to give you the best performance out of the back. Those are really the main ones, but sometimes it may be necessary to tighten other things, and the other bolts on the back require the 10mm spanner. In this case, I'm using a ratchet spanner. You don't really necessarily need a ratchet spanner. A plain one will do just fine. So the ones to look at are here. You'll see that these bolts run through slots, and those slots are there because the backrest can adjust from the size of the J3 back itself up to 5 centimeters wider, and that allows the back to fit both you and the wheelchair. So usually the point of that is when you get the back, usually that's something that's done at time of fitting and might not need doing again. But if you want to tighten it up, pop your 10mm spanner on there and just until you feel it secure, and then that's plenty tight. The other two that you might need to tighten up are here on the inside. There are tracks that allow the back to adjust in angle and also in depth to get the right fit for you. Obviously, gold standard, if you're wanting that adjusted, the recommendation is to work with a professional who's used to fitting these backs and knows what they're doing, so you don't end up basically in a wonky adjustment that doesn't work for you. But if you're just doing maintenance to tighten up, that's fine to just pop a 10mm spanner on there and give it a little tighten. And to be honest, that's it. That is how to look after your J3 back in 3 minutes. If you're watching this on YouTube and it was any help, please give us a like, and also I'd like to hear in the comments what videos could we make that would be helpful for you to get the most out of your Sunrise medical equipment. Thank you very much.